You were there. You were in the administration. You were running the CDC at the very beginning of PEPFAR. What do you think the US government was thinking, and what compelled them to take on this issue when there's so many health issues to take on? What compelled the United States to act?
You know, it's a bittersweet question, because the determination to really engage in Africa with substantial investment to try and change the trajectory of the epidemic occurred, but it did occur late. It occurred after many years of smoldering infection and then awareness without really effective global action. But when the United States and other countries did step up, I think one of the primary motivations was the shock of recognizing just exactly how severe this problem was. Until you really step back and look at the statistics and you really understand what it means for generations of people on the continent, it was very difficult to make the connection between how we were seeing and living with HIV in America and what was really happening here in Africa. And I remember very early in my career, when I was still at San Francisco General Hospital, the profound recognition of the possibility of heterosexual transmission. Most people did not really accept that you could acquire this disease through heterosexual sex for a long time. But when it became overwhelmingly clear that the virus doesn't really care what mucous membrane it's attaching to or how it got there, the whole scope and magnitude of the problem really became clear. And I think there was, the shock of recognizing the magnitude. Second, the awareness that the magnitude was not only a tragedy of human health, but it was a tragedy for economic development, and that it was not going to be possible to continue to engage in African development in a meaningful way without dealing with the problem in a substantive way. But there was the third dimension to this that I think not everyone fully appreciated and may not fully appreciate now. This has to do with stability and national security. And we got visited in San Francisco in the early 1990s by the CIA, because they had come to conclude that the impact of HIV in Africa was a major force of political destabilization, and that if it wasn't addressed as a national security issue, there was a danger that not only would more lives be lost from the standpoint of the disease, but it would be amplified by conflict, regional instability, and potentially even war. So I think all of those factors came together. One, the shock of how horrifying this tragedy was and the compulsion to do something meaningful about it. Second, the growing awareness among Americans that it mattered to them what happened in the continent from a humanitarian and a philanthropic perspective, but then ultimately the recognition at a policy level that it wasn't just an issue of development, it was also an issue of national security. And the stimulus, I think, to tip this over the edge of investment really came from leadership. Not just President Bush, but many leaders in the government and in Congress and in the religious communities and in the health communities around the world really stepped up and said, we can make a small investment, but it won't make a difference. If we want to make a difference, we're going to have to make a big investment. And this really is the single largest investment that the US government has ever made in not just a health issue, but an international aid issue. And I think it did make a difference, and I feel rewarded for that. But as Dr. Birx knows better than anyone, complacency is our worst enemy. And if we don't stay the course and continue to stay with this problem, we'll see a return to the pre-treatment era, because we are beginning to relax our outlook and beginning to think that this problem's under control. And when I saw the word curable up there, it made my heart stop, because maybe it will be curable someday, but it is far from curable today.